Hello and welcome to Public Health Conversations, an interview series by the Institute of Public Health. I'm Martin Grant, and in this series we will hear from experts at the Institute and have conversations around key public health issues which affect all of us. Like a lot of people, we are working from home and trying new technology, so the sound quality may be a little patchy in places. But I do hope that you will find the interviews relevant and interesting to your work. Today I'm joined by Dr Annette Burns, who is Public Health Interventions Officer for Loneliness at the Institute. Annette undertakes a programme of research around our understanding of loneliness in older adults and looks at its predictors, impacts and potential interventions. Annette is also a visiting researcher at Ulster University. With people cocooning and staying at home, Covid-19 has put a real focus on loneliness. Annette, you might start with explaining what is loneliness, or how would we define it?
Yeah, absolutely. There's been a huge focus on it, as you said, and it's interesting because I've been researching loneliness since September 2018 now, but it has been really interesting the last while. Everybody is now talking about loneliness in this time of social distancing, and it's really become isolation and loneliness are on everyone's lips. But loneliness, we can define it as it's a very subjective, personal thing, and it's when we personally feel that there's a gap between the social contacts we'd like to have and those we actually have. So that gap that you feel could be in quantity or in terms of quality. So in terms of quantity, simply numbers. So how many people are in your life and how often you have contact with them. And then in terms of quality, it could be that you have lots of friends or acquaintances, but you might be lacking a closer special bond with somebody who you could really talk to or confide in. So that would be more emotional loneliness than social loneliness.
Okay, so there is quite a difference, I suppose, between loneliness and isolation.
Yes.
How would you kind of describe that difference?
Yeah, there is a difference. So isolation then, I've just mentioned loneliness is very subjective and it's what we feel personally. Isolation, on the other hand, is objective and it's something we can observe and measure. And it just means how many people are in a person's life and how often they have contact with them. And it's not to do with how happy they are with that. It's just to do with what they actually have going on. So it could be in terms of whether or not they live alone, whether they're married, friends or close family members, and how often they have contact with them. So it's possible that you could be objectively isolated when I look at you, but you might be perfectly happy and not experiencing loneliness within that. And similarly, it could be that you're surrounded by people all the time, you're married, you have children, you get very little time to yourself, but you could actually be experiencing loneliness. So they're not a perfect relationship, isolation and loneliness. And it's just important to remember that loneliness can therefore be quite hidden. And really the only way to know is to ask somebody if they're feeling lonely. And even then, we might not get it because it can be quite stigmatized as well, loneliness. Maybe less so in current times when we're all going through this together. But certainly before COVID-19, we would have talked a lot about the stigma of loneliness as well.
Okay, that's given us a real kind of overarching or kind of an insight into loneliness. And I know that you're also part of an international research group looking at loneliness, and you were also one of the signatories to a letter published in The Lancet a couple of weeks ago. What is that kind of international context of loneliness? And I know that letter called for a unified approach to loneliness. Why is that important? So you might maybe just tell us maybe a bit of the international context of loneliness and why that unified approach is needed.
Yeah, absolutely. So we had a meeting back in December 2018 in Belfast where we brought together a lot of international experts on loneliness and isolation for several days, just to really discuss loneliness in older adults and the issues internationally, and to come together to try and progress this issue. And coming out of that, then we produced consensus to write this letter you mentioned in The Lancet, which calls for a unified approach to loneliness. And what that really means is just that we're all kind of working together to progress things, because a lot of the issues in terms of loneliness research internationally at the moment are around things like definition. So we don't all measure loneliness in the same way. And it's very difficult then for us to draw conclusions or compare things internationally if we're not comparing like with like. So one of the main things we talked about was to have a universal definition of loneliness and to all measure loneliness in a similar way. Other things then we talked about were things that might lead to loneliness and things that might be caused by loneliness. And there's difficulties here too, because we talk about things like poor health, and it's difficult to untangle whether poor health leads to loneliness or whether loneliness leads to poorer health, or whether it's a bit of both, which is quite likely. And to understand that better, as well as all defining and measuring loneliness in a similar fashion, we also need to look at things over time in large studies, and that will help us to understand what's going on there. There's a lot of evidence, for instance, around loneliness and depression, and it does seem that loneliness is of depression. But just to confuse things, it does also work the other way, in that depression can lead to loneliness as well. And finally, in that letter, we talked about the thing which most people are usually most concerned about, which is interventions. What are you going to do about this? How do you solve it? And again, unfortunately, there's not a lot of evidence. There's very few studies looking at interventions, and the evidence we do have doesn't show us clear winners at this stage. I think things, though, like technology, particularly in this current time, are something we're going to need to do a lot more work on. I was recently involved in a rapid review looking at the effectiveness of video calls for loneliness in older adults. But because we found so few studies to look at, again, we couldn't draw strong conclusions on that. Intuitively, though, it does seem, I know a lot of people at the moment are using Skype and Zoom, people of all ages, and we feel like there's something you get there over a simple phone call when you're getting contact in the way that we're currently allowed to get it remotely. So I think we need to do a lot more work around that, around using what we have. But yeah, there's lots to be done.
Okay, and so that's given us a good overview of the international kind of context of the loneliness. But if we move closer to home, what do we know, or what can we say about loneliness in Ireland and Northern Ireland at the moment?
Yeah, so closer to home, I suppose our two best sources of information really are longitudinal studies on aging. So we have Tilda in Ireland and we have Nicola in Northern Ireland. And these are really useful because they give us population level data. So they go out and interview adults in the community age 50 and over. And they've done it in such a way that this group is representative of all adults age 50 and over living in the community. So that's really useful information. And we know from that, because they also ask about loneliness, that the numbers they are often lonely among adults age 50 and over are 5% in Northern Ireland and 6% in Ireland. So quite low, really, in terms of people who are reporting they are often or always lonely. And that's in line with what we see internationally. And it's important to know that the majority of older adults are not chronically lonely at all. But whereby you do experience that loneliness often or always, that's when it starts to become a problem. And we've looked at what that might be associated with as well, briefly. And we found that it's not associated with whether you live in an urban or rural area, for instance. It is associated with things like gender, age, your education level, your marital status. Unsurprisingly, it will be high among those who've been widowed or separated or divorced. And it's also associated with poor physical health and poor mental health as well, and also associated with income as well. So those with higher levels of education, higher income, in terms of loneliness.
Okay, so that's what we know currently on that issue. And if we look at, say, the policy landscape in Ireland and Northern Ireland, what do we currently have? Do we have strategies to address loneliness in Ireland and Northern Ireland?
Yeah, so I think it's very much on government's radar. There's a lot of interest in loneliness at the moment, and there have been government strategies we've seen from a number of countries recently. England had their Connected Society strategy, and there's been documents from Scotland and Wales since as well. We don't yet have government strategies for Ireland or Northern Ireland, but like I say, we have a lot of engagement with this topic from politicians, and we have a task force in the Republic of Ireland, and we also had €3 million of funding last year announced for interventions for loneliness as well. So I think it's only a matter of time before we also have our own government strategies on loneliness in Ireland and in Northern Ireland as well.
Okay, so it's really on the radar of
Absolutely,
our
yeah.
policymakers, yeah.
Hmm.
I mentioned at the start that obviously COVID-19 has put a real focus on loneliness, isolation, and mental health, and we've seen restrictions put in place across the world to, I suppose, protect the health of populations. But do we know what impact some of those restrictions might have on our population and specifically on loneliness? It's very early days, but do we have any
Yeah.
sense of what that might be?
I think the short answer is obviously we don't know yet, but I think it's very reasonable to expect that we will see increases. We're obviously seeing increases in isolation. By definition, people are being more isolated at the moment for their and others' health. And this, as I say, can lead to loneliness for some. I think it's going to be really interesting to see what happens there in terms of we might have people who haven't really experienced much loneliness before now experiencing it and understanding it a bit more. We might have people who were already quite lonely and isolated and see how they find this. It may be that they don't notice a huge change, or for some people it may be that they're actually getting more contact now in this time where people are reaching out more. So it's going to be really interesting to see what's going on there. Obviously it's concerning, and I think there probably are going to be negative impacts on people's mental health with this time. We're doing an online survey ourselves. I know there's a lot of surveys at the moment, but we've linked up with our international group you mentioned earlier. So that's iLink. It's an international loneliness and social isolation research network. And we've come together to produce a survey covering all of us instead of 20 more surveys. The idea was to pool our expertise and produce a survey that we're going to promote across a number of nations and collect data from people of all ages in relation to loneliness and isolation at this time, as well as just before this time and other. So that should be a really interesting opportunity to learn, because this situation has created somewhat of a natural experiment around loneliness and isolation. And it'll be really interesting to see how the people who respond to the survey who are doing well, what they're using to cope, and also people who are maybe not doing so well, what their things look like for them at the moment.
Absolutely, and we'll have to keep an eye out for those results of that survey as well.
And
Um,
for the survey as well, because we want people to participate too. So
Absolutely,
absolutely.
share
Yeah.
the word.
Yeah.
Obviously, you touched on a couple of things there. That obviously a lot more people are maybe using social media and video chats like we're doing now, Zoom and WhatsApp calls. And I know I've been part of several family quizzes, and you see them on
Mm.
social media. A lot of people are connecting through this new reality, I suppose. And obviously, a lot of our population might not necessarily have access to some of that technology that enables that kind of connection. But do you think that we might see a change in the way people kind of stay in touch with each other and connect with each other as a result of COVID-19?
Yeah, it's interesting. I mean, I suppose younger people were already using this stuff a lot, as we know. They were already FaceTiming and everything long before this. And I think, there's a certain element of getting a bit Skyped and Zoomed out of it at this point, and we're going to look forward to when we're allowed to having face-to-face contact. But yeah, I think it's also really interesting whether it will increase usage among people who wouldn't have been using it before. I know in New Zealand, they straight away do their best to equip people with technology and access to internet to try and tackle that. So it'll be interesting to see how successful that is. And I know myself as well, like that, I've been trying to get my parents to do video calls and things, which is new to them. So yeah, I'm hopeful that we can get benefits out of those for people who haven't been using them before. It does seem like a real untapped resource with ODRAD, for instance, in a nursing home where you're not going to, in normal life, you're not going to be able to necessarily visit every day, but if you were able to do a video call, that could be really beneficial perhaps. And I think it's like anything, it'll work for some people, it won't work for others, but I think we definitely need to move with the times on that for older people for sure.
Yeah, thanks very much, Annette, for that. I suppose that we are now probably in week, I think it's 6 or 7 of kind of the restrictions since they've come in place. And obviously, people might be a bit fatigued at this stage of some of the restrictions,
Mm.
maybe challenged by some of the restrictions as well. And quite possibly, maybe some people might start possibly feeling lonely or maybe questioning are they lonely. But what would your tips be for people to kind of stay connected?
Yeah, I think it's the same as at any time. You know, the tip if you're feeling lonely is always to reach out to people and like try and engage. At this time, different because we need to do it more remotely. But also just to realize that you're not alone in your loneliness, which I think that's the thing about this situation. It's kind of making us all feel a bit more connected in one sense while we're more apart in another. Um, Everybody feels lonely at times. It's just a really normal part of being human. So don't worry, it's not some pathology, it's just a natural signal that you need to reach out and connect with somebody. I think like that, trying those new techniques of Zoom and quizzes and whatever it may be. And obviously remember as well that this situation is temporary. And obviously it's really difficult for many people, but it's not forever.
There is life beyond COVID-19.
Yeah, there is. Yeah.
I suppose just to wrap up, obviously today is European Public Health Week with a focus on mental health. How are you finding things in it, and what are you doing to mind you?
Yeah. Like everybody at the moment, you know, we all have our good moments and bad moments. But there's certain things that definitely help. I think, you know, that walk outside, it always helps. You never feel, you know, worse after going for a walk. Also, like I've said, just remembering to reach out to people and to schedule in those calls and those contacts that you would normally have from running into people, but you're not getting now. And also just to give yourself a break as well, because this is a really strange situation we found ourselves in. None of us were prepared for this. We didn't see it coming to this extent. So you are going to feel overwhelmed at times, and that's okay. And accept it and talk to somebody, because everybody is going through the same thing, and we're all having our moments.
Great stuff. Thanks very much, Annette. I suppose thank you very much for taking some time out of your day and sharing some insights on loneliness. I think that's given us a kind of an overarching view of the topic. It's very much so in the media spotlight and discussion, so I think that was useful. That's all, I suppose, for this interview. But if you've enjoyed today's discussion, make sure that you subscribe to the YouTube channel and also sign up for the Institute of Public Health newsletter. We'll be sending out various content over the next couple of weeks as well. But Annette, thanks very much for joining us.
Thank you.